Hello, my name is Katie Neglia, and today I'll be presenting on the life-saving power of global organ donation advocacy. Before I begin, here's a little bit about me. I'm a rising senior at Carmel High School in Carmel, Indiana. At Carmel High School, I'm involved in a variety of activities, including serving as president of my school's top all-girls competition show choir called Accents. I'm also highly involved with my school's dance marathon, where I fundraise for Riley Children's Hospital all year long. Last year, I worked with a team of leaders at my school to fundraise over $600,000 for the kids at Riley. In addition to this, I'm an elected member of my school's cabinet student government group, HOSA, Key Club, peer tutoring, NHS, and my school's freshman mentoring program. While all of these activities have shaped my character, the one that has had the most impact on me, and is the launching point of this presentation, is Student Organ Donation Advocates, or SODA for short. SODA is a national nonprofit organization with student leaders around the U.S. working to advocate for organ donation registration and education. I started the very first SODA chapter at Carmel High School and lead our chapter as president. My future goals include attending medical school to become a practicing pediatrician and traveling around the world to improve global health. Organ donation is the process of taking healthy organs and tissues from one person who has legally consented for transplantation and putting them into another person in need. Organ donors can be living or deceased, and a single organ donor can save up to 8 lives from organ donation and heal up to 75 people with skin and tissue donation. In 1954, the kidney was the first human organ to be transplanted successfully. Since then, medical practices have drastically improved, and now the heart, lungs, liver, kidney, pancreas, and intestines can all be transplanted. According to the CDC, the most commonly transplanted organ is the kidney, due to the fact that because they come in pairs, a living donor can donate just one of their kidneys and continue life with little to no adverse effects. Tissue donation is also increasing in prevalence within the medical community, including corneas to restore sight, valves and veins for blood flow, bones for cancer patients, skin for burn victims, and tendons to restore mobility. UNOS, the United Network for Organ Sharing, reports that around 3.3 million tissue grafts are distributed each year, and about 2.5 million grafts are transplanted. In the United States alone, more than 100,000 people are waiting for a life-saving organ donation. That's enough people to completely fill the Lucas Oil Football Stadium, which is shown in this picture, and then fill it again a second time. The current rate of worldwide organ donation is far behind the number of people in need. This visual from Eurostat in 2019 represents the organ donor rate per million by country, with the darker colors representing a higher rate of organ donation. Spain, shown in the very dark blue, is a rare exception, having the highest rate of organ donation in the world. The remaining majority of the world is very gray and has dangerously low organ donation rates. According to the CDC, in 2021, there were only approximately 14,000 deceased organ donors, with each providing on average 3.5 organs. Living donors provide on average only around 6,000 organs per year. This causes a disconnect between those in need of organ donation and the care that highly trained healthcare professionals can provide. Because so many people around the world are being denied organ donation's life-changing effects, this is a major global health issue. The solution is global organ donation advocacy, which has 2 main subsets, registration and education. According to Donate Life America, organ donation registration is when people legally grant permission for their organs to be donated to people in need should they pass away. A person can register in the National Donate Life Registry at registerme.org and the iPhone Health app, or most commonly when they first get their driver's license. The second part to this solution is education. There are so many myths surrounding organ donation, such as doctors won't try as hard to save someone if they know they're an organ donor, or organ donation causes problems with burial and funeral services. Without proper education to disprove these myths, less people will register as donors, and fewer people will be given the second chance at life that organ donation provides. I personally witnessed the life-changing miracle of organ donation 2 years ago when my family friend, whose kidney function has gotten so impaired that he crashed his car, finally received a kidney from a living donor. This incredible story of selflessness inspired me to take action and inspire change in my community, so I launched and led a student organ donation advocates chapter at my own high school. As president, I organized a team of other inspired individuals to help lead our quickly growing chapter. Together, we put big goals into action, growing our social media to over 200 followers and creating our own donor registration link. We organized a booth at the annual Indiana Donor Network 5K Walk to Save Lives, where we celebrated the gift of life with the over 500 people in attendance. At our booth, we had conversations with people eager to learn about organ donation and handed out informational pamphlets we created. At some of our other outreach events, we decorated holiday cards and gave them to patients at the St. Vincent Kidney Transplant Center, sharing a message of hope. We also invited an organ recipient and her donor to speak to our chapter and learned so much about each side of the transplant procedure. In total, Carmel Soda shared the life-saving message of organ donation with over 1,200 people and registered 11 donors. Besides the numbers, we inspired a culture of changemakers within our community. I will only expand my advocacy efforts in the coming years when I will again serve as president my senior year of high school. I also plan to start a student organ donation advocates chapter at the university I eventually attend. In summary, one organ donor has the potential to save up to 8 lives and heal up to 75 people. However, in the United States and around the world, there's a major gap between the amount of people on the transplant waiting list and the amount of registered organ donors. In the US alone, every 9 minutes, someone is added to the national transplant waiting list. To solve this problem, people must advocate for organ donation through registration and education. I've personally taken steps in my community to increase awareness around organ donation through my school's SODA chapter and encourage others to do the same. Here are my references. First and foremost, I'd like to thank the Johns Hopkins Global Health Leaders Conference Committee for providing me with this incredible opportunity to present on what I'm passionate about and learn from so many talented professionals this summer. I'd also like to thank Nicole and Sophia, the student outreach leaders within SODA National, and my Indiana Donate Life OPO, Andy, for supporting me in my advocacy. Here's my contact information. I would be more than happy to answer any questions you may have or discuss my presentation with you in more detail. Thank you so much for your time.